Antisocial personality disorder is a mental health condition that affects how a person thinks, feels, and interacts with others. People with ASPD often disregard or violate the rights of others and show little empathy. For instance, someone with ASPD may frequently lie to their friends, make up stories to gain sympathy, or manipulate family members for personal gain without any sense of guilt or remorse. Imagine someone who regularly steals money from a family member's wallet but never feels bad or apologizes when caught. Instead, they might blame the person for not locking their wallet away or even laugh it off, showing no understanding of the emotional hurt they caused. This behavior might seem cold or manipulative, but for someone with ASPD, it's a reflection of how they approach relationships and life in general. People with ASPD also often struggle to conform to social norms, have difficulty maintaining relationships, and may engage in impulsive or aggressive behaviors. It's important to recognize here that ASPD is not just about occasional bad behavior, but a long-term pattern starting in adolescence and continuing into adulthood. It's also important to note that while the term antisocial in everyday language might refer to someone who is shy or avoids social interaction, in the context of ASPD, it refers to behaviors that are against societal norms and potentially harmful to others. ASPD is relatively uncommon in the general population, with prevalence estimates ranging from 1% to 4%. However, it's more prevalent in certain settings, such as prisons, where rates can be as high as 50% to 80%. The disorder is more commonly diagnosed in men than in women, with some studies suggesting a ratio of about 3 to 1. Causes of antisocial personality disorder. The exact cause of ASPD is not fully understood, but researchers believe it's the result of a combination of genetic, environmental, and biological factors. Number 1. Genetics. Research suggests that children born to parents with personality disorders, particularly those who have ASPD or similar traits, are more likely to develop it themselves. This could be due to genetics or learned behaviors. While no single gene causes ASPD, certain genetic traits, such as impulsivity and aggression, may be inherited. Number 2. Childhood environment. Early life experiences play a crucial role in the development of ASPD. Children who experience neglect, abuse, or unstable family life, or exposure to violence have a higher risk of developing the disorder. Inconsistent discipline also contributes to this. Imagine a child growing up in a household where they are never praised for good behavior, but they quickly learn that aggressive behavior, like hitting a sibling, gets them what they want. Over time, this child may develop a pattern of using aggression or manipulation to control others without feeling guilty or remorseful. Number 3. Brain structure. Some research suggests that abnormalities in brain regions that regulate behavior, emotion, and impulse control, such as the prefrontal cortex and amygdala, may be involved in ASPD. Individuals with ASPD may have reduced activity in these areas. So, they might struggle with understanding emotions like fear or empathy because these parts of the brain don't function the same way as they do in people without the disorder. For example, if most people witness someone crying after a hurtful remark, they might feel bad and apologize. In contrast, someone with ASPD might not even recognize the emotional impact of their words or simply not care. Symptoms of antisocial personality disorder. The symptoms of ASPD can vary widely, but there are common traits that appear across many cases. One defining symptom is a disregard for the rights and safety of others. For instance, a person with ASPD might frequently drive recklessly, even if it endangers others, or engage in aggressive behaviors like starting fights without any concern for the harm they could cause. Take the example of someone who repeatedly lies at work to get ahead. They may fabricate stories about their past experiences or take credit for work they didn't do. When confronted, instead of admitting fault, they might deny everything or shift the blame onto a coworker, showing no remorse for the damage they've caused to others' reputations. Another common symptom is impulsivity. People with ASPD may act without thinking about the consequences. This can lead to reckless behaviors, such as unsafe driving, substance abuse, or financial irresponsibility. Irritability and aggression are also hallmark symptoms. For example, someone with ASPD might have frequent angry outbursts over minor inconveniences, often escalating situations into unnecessary conflict. They may be prone to violent behavior or constant confrontations, showing little regard for the distress or harm this causes others. Individuals with ASPD may also have a pattern of failing to meet obligations. This might manifest as repeated failure to sustain consistent work behavior or honor financial obligations. Finally, a lack of empathy or concern for others' feelings is a key trait of ASPD. If a person with ASPD hurts someone emotionally, they might dismiss the other person's feelings altogether. For example, after emotionally betraying a friend, instead of expressing remorse or attempting to repair the relationship, they might say, "You're overreacting," or "You shouldn't have trusted me in the first place." Diagnosis of antisocial personality disorder. Diagnosing ASPD can be tricky because people with the disorder often don't think their behavior is problematic. They're unlikely to seek help voluntarily. Usually, diagnosis occurs after legal issues or serious conflicts in personal or professional settings. For instance, someone may only get evaluated for ASPD after several run-ins with the law, such as repeated arrests for theft or assault. A mental health professional will assess the person's behavior patterns, often going back to childhood, and check for key symptoms, such as disregard for others' rights, impulsivity, and lack of remorse. According to the DSM-5, to be diagnosed with ASPD, the person must show these behaviors consistently from the age of 15 and meet certain other criteria, such as having a history of conduct disorder before age 15. A professional might also consider whether the person shows signs of other mental health issues like substance abuse or depression, which can often accompany ASPD. For example, someone with ASPD might also have an addiction to alcohol, which worsens their impulsive behaviors and disregard for others. Treatment for antisocial personality disorder. Treating ASPD is often challenging because people with the disorder often do not feel that they need help or do not want to change their behavior. However, treatment is possible, especially when the individual is motivated to make changes. Therapy is the most common form of treatment, but success depends heavily on the individual's willingness to engage. Cognitive behavioral therapy, CBT, can help someone with ASPD recognize their harmful behaviors and work on changing them. For example, in therapy, they might be asked to reflect on a recent argument where they manipulated a loved one to get their way. Through CBT, they would be encouraged to identify alternative, healthier ways of handling the situation. Medication isn't typically used to treat ASPD directly, but it may be prescribed to address related symptoms like depression, anxiety, or aggression. For instance, a person with ASPD who frequently experiences violent outbursts might be prescribed mood stabilizers or antipsychotics to help manage these aggressive impulses. However, there is no medication specifically approved for treating ASPD itself. Another important aspect of treatment is teaching individuals how to build empathy and manage relationships better. In group therapy settings, for example, someone with ASPD might practice responding empathetically to others' problems, learning how to engage in relationships in a healthier way. At the end, while treatment can sometimes be challenging, with the right support, individuals with ASPD can work on developing healthier relationships and reducing the negative impacts of their behavior. Now, we want to hear from you. Have you ever known someone who displayed signs of ASPD? How did it affect their relationships with others? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.